I saw there were a lot of cases, in fact, majority of cases of appendicitis, which was suspected as appendicitis, were undergoing imaging. I analyze these patients and see what kind of imaging are we using, what do we do in these cases, what do we do when we're not sure. Before we dive into further details, let me quickly give you a small introduction about myself. I am Naman Vashistha and I'm a resident doctor here in Manchester. I am working with the National Health Service here, so I'm at the heart of healthcare here at the United Kingdom. We see around 50,000 appendectomies performed every year here in the UK. Although it's a clinical diagnosis, imaging is vastly used in appendicitis cases. When in doubt, despite the availability of a lot of imaging modalities, there's no set guidelines favoring one imaging modality over the other. Now, this study had a simple objective to actually assess the types of imaging modalities we are depending upon to confirm appendicitis. How much are they actually efficient? How much of them actually are we using, and why are we using them when we are using them? Here's how I did it. We collected the last 200 patients' data who have undergone appendectomies. We analyzed how many of them have appendicitis. We excluded the patients who did not have appendicitis, so we just keep our focus on appendicitis. If they did not have any imaging prior to the surgery, we excluded them. Out of 200 patients, 70 got excluded. We examined the radiology reports. A variety of modalities were used: ultrasound, CT, and MRI. In a lot of patients, we compared them to the postoperative histopathology report to see how many were actually right in detecting appendicitis. So this was a basic layout of the study. Moving on to the next slide. Now, in detail, what I found on analyzing these cases was a lot of patients have had ultrasound scans initially. Let me tell you, 47 patients out of 130 patients, approximately one-third of patients, 1 in 3 patients, had an ultrasound scan in the beginning. We try to analyze patients for their age, for their gender, and try to study if there's a pattern, if the diagnosis was confirmed later on after the histopathology report, after the surgery. It's interesting to know what happened next. This slide sums up the cumulative results of how the radiology department as a whole performed in detecting acute appendicitis. The radiology department got 94% of the cases detected correctly. There were approximately 6% of the cases that went missing. It was interesting to take it a step further and see what's happening within these numbers. It's going to be very interesting to note that there's something about ultrasound that's not quite right, and we're going to look further upon it in the next slide. Here is data about the sensitivities and a few other criterias. I want to mention these before we move on to the ultrasound scan. On the left side, the sensitivity overall is 97%, which is a very good sensitivity. The positive predictive value is also very good of cumulative scans. And patients who've had appendectomy because of a falsely positive radiology report are very less, which is again ideal. So we don't want to have unnecessary appendicitis, which is good here, because the patients with negative appendectomy rates were 3%. I think the target is 5 or 10%, less than that. So again, it was a fantastic result. But what's happening with ultrasounds? Here is what happens next. This page is entirely dedicated to the ultrasound scan and the results. Out of 130, 47 patients had the ultrasound scans first. It's a good mix of population. The range of age is from 7 years old to 52 years old. The mean age and median age is close to 24, 25, which is a good indicator that the data is not very skewed. The proportion of females to males is also very balanced. So females 49%, males 51%. On this slide, I'm going to briefly talk about age distribution, dividing the entire population into these 3 groups. I found out that the percentage of people was fairly balanced. So less than 18, 16 patients, which is 34. So close to 30, 33, 1/3 of the patients in each of these following categories. So what I found, it's very interesting here to note, is patients with less than 18 years of age had a very good ultrasound results. But what's happening with the group of 18 to 30 years? It's actually not very good. It's just 28.5% sensitivity. The percentage is more than 30 years of age was neither very high, neither too low. It was around 55%. The cumulative, the whole aggregate of the sensitivities throughout these 47 patients who had ultrasound scan was 53.5, which is very poor performance. So the thing is, pregnant women and children rely on ultrasound heavily. Why is that? Ultrasound is a radiation-free imaging. You don't have exposure to harmful ionizing radiation like X-ray or CT scans. We are using a lot of ultrasound scan in pregnant women and children. Is there a risk of appendicitis getting missed a lot more than the other population? Something to keep in mind when we order these scans. In summary, 21 cases from a total of 47 cases of ultrasound were missed. Okay, I briefly touched this topic on the last slide. The question we ask ourselves is, if the ultrasound scans are performing so bad, why are we still using it? And to the extent where at least 1/3 of the patients are having ultrasound scans offered. It's a table of comparison between CT scans and ultrasound scans. Everyone knows the ultrasound scan is not very sensitive, it's not very accurate. Why is that? There is a few factors that actually make it a little less reliable, such as you have to depend a lot upon the operator skills. The image quality and the technology is not very high resolution. Factors such as the body weight, body fat, and the body habitus, bowel gases interfere with the ultrasound scan. The good side of ultrasound scan is it's non-invasive, it's a quick scan, you can get it quick, there's not much waiting list, you don't have to go into a machine, it's time efficient. These are the benefits that you get with ultrasound scans. CT scan is a very high quality imaging. It's a very reliable, has very high sensitivity, it has very low negative appendectomy rates, although there's a very big risk of radiation with it, so it can cause cancer. Obviously, ultrasound is better than the CT scan in terms of cost. CT scans don't rely a lot upon the operator skills, and the patient factors do not affect the CT scan results. Understand what are the pros and cons of both imaging modalities, so that next time we are requesting one, we know why are we doing it and what is the benefit of doing it versus the cons of it. We have gone through a lot of slides here. This slide gives a quick summary of how the ultrasound scan is performing overall in detecting appendicitis. Total number of patients were 47, approximately 1/3 of the patients that were offered ultrasound scans to detect appendicitis. The total sensitivity of ultrasound scans is very low. It's not as good a scan as others, such as CT and MRI. Sensitivity is sitting at 53.5%. We have analyzed the sensitivity variations according to the age group in previous slides already. 21 cases were missed out of 47, making it 44% of total cases where ultrasound wasn't able to correctly identify appendicitis. So it's not a very reliable scan. Later, these 21 cases were offered CT scan or MRI, where 11 were picked up in CT scan and 6 of these cases were picked up in an MR scan. Unfortunately, 3 of them did not have the imaging modality that could confirm the diagnosis, and they have had the surgery, and the diagnosis was confirmed after the surgery. As we are approaching towards the end of my presentation, I thought we can have a few take-home points from this study. The conclusion: the ultrasound scan, when used alone, is not as reliable in confirming appendicitis as some of the other scans. The numbers highlight that the ultrasound sensitivity significantly drops in patients with the age group of 18 to 30 years, which is as low as 28% in the study I concluded. Escalation to CT or MRI is a good idea if the ultrasound scan is going against your clinical intuition. It is a clinical diagnosis, and if you're convinced that it's appendicitis, there's no harm in taking them to the theaters, but it's a case-by-case analysis. While ultrasound is fast and easily available, it avoids radiation exposure, but then you have to also consider its reliability and the results get affected by operator skills heavily and patient factors such as bowel gas and body habitus. I hope all of you have learned something new and helpful. I am Naman Vashist, and thank you all for listening so patiently. I hope you keep on having a fantastic day. I'm Naman, signing off. Thank you.